All right, so we're gonna use our patient here just to demonstrate some basic structures of the knee. Obviously the patella would be the most prominent, or the kneecap would be the most prominent structure, so that's always a good starting reference point. So we have the superior aspects of the patella, the inferior aspects of the patella, and once you're able to kind of access both joint lines, medial and lateral, you should be able to use that as a guide to point out the other structures and be able to palpate. So if we come just inferior to the kneecap or the patella, you feel this kind of band or cord-like structure just below the kneecap, and that's going to be our patellar ligament, or often called the patellar tendon. If we were to come superior and medial, Molly, if you could just go ahead and squeeze your thigh a little bit. Good. Just through observation, we can kind of see this big belly muscle here. That's going to be our vastus medialis, but as far as palpating it and being sure that we are on it, we're going to come superior from the patella and then just medial a few fingers, and you should feel a good belly tissue of the vastus medialis from there. From there, let's come back down and go medial and maybe point out the MCL. So go ahead and relax, Molly, and we're going to bring you up into just a little bit of flexion here. This is going to kind of open up some of the joint space and allow us to kind of access that medial joint line. And so if we were to come middle of the patella, start to access that middle joint line, that space between the femur and the tib, then we kind of find that. And then as soon as we come to that, kind of that next band-like tissue, we know we're kind of right over that MCL. Can you kind of feel that there, Molly? Mm-hmm. From there, if we were to go lateral to maybe point out the lateral femoral epicondyle, again, we would reference back to the patella, find that kind of medial joint access line, that joint space, and that bony prominence just superior to that is going to be our lateral femoral epicondyle, and that one's pretty easy to palpate. And then finally, the greater trochanter is in the hip, and it's the bony prominence of our hip. And so there's two ways we could access it. We could start on the outside of the thigh and work our way up, or we could start at the gluteus and work our way down. So if we just palpate into that kind of muscle tissue and then work our way down, that bony first big prominence that you get to, that's going to be our greater trochanter, and a key kind of hip structure to kind of have an idea of how to reference the other muscles around the hip.